You also went through speech pathology, speech therapy.
Yes, I do.
What do you remember about that?
The number one thing I remember is I sneezed and my trach shot out and it almost hit her, but it just bounced off the walls and everything like that. So, but what I remember from speech, doing memory activities and how to get my vocal cords to like work again. Pretty much, I had to like when I had my jaw wired shut, I had to like just like open my mouth as wide as I could, try to strengthen those muscles and just keep doing it, or like hum, sing, and do all that. And I think that's why I talk so well now compared to like a lot of people, is because I love to sing in my car, and I sing in my car so loud all the time. So I feel like after learning that from the speech pathologist, because I was always like, like then you have to go, yeah, and like do all the vowels and everything. So, yeah.
Has your voice changed from before the accident?
I don't think so.
Do you have any videotapes of you talking that would have been made before?
Yeah, I do.
Might be useful to see something like that.
Okay.
Because if you don't mind, then people can see a comparison.
Mm-hmm.
Did you have any speech-related deficits that weren't physical in terms of the trach and the broken jaw and the lack of use of those parts of your speech system for the time you're in a coma?
Just part of the memory, like things I did in speech to help with memory and everything like that.
What about learning to use language again? Contexts in sentences and things like that.
Like social situations.
Well, we'll talk about that more a little bit later, but I'm talking about just things where you had an idea of a word, but the word you said wasn't the same as the idea you had of it, anything like that? Misnaming objects or having a hard time thinking of the name of something?
I do that, but I think it's
But that wasn't the focus of your speech pathology?
no, not at all.